on how they're coping with COVID-19 and how we've adapted our programs to meet the needs of women and girls who are most affected by the pandemic. I wanted to give those of you who are a little unfamiliar with the Village Savings and Loan methodology, here's a very brief introduction. VSLAs, also known as savings groups, are self-selected groups of about 20 women who save together. They take small loans, low interest loans from those savings. The groups are self-managed, but CARE helps form them, train and coach groups in financial management. This is a trust-based platform for savings and lending. The women in the groups are in charge, not MFIs or lenders. And because they're neighbors, friends, family members, they're invested in what happens with each other. And there's a nearly 99% repayment rate on loans, 99%. VSLAs for CARE can be a lifeline for our over 8.5 million VSLA members globally. And they're often the only source of money for many rural women with no access to formal finance and limited mobility outside of the households. They also serve as a platform for service providers and NGOs like CARE to provide training on nutrition, agriculture, sexual and reproductive health, and perhaps most relevant to our discussion today, VSLAs serve as a node of communication and response with communities during a crisis like COVID-19. So let me introduce my panelists without further ado. They're going to talk to us today about how we've reached VSLAs at the outset of the pandemic, to understand the needs of communities and women and girls specifically who were disproportionately affected by COVID-19. Mariam Garba Usman in CARE Nigeria is our VSLA project manager. So she's in charge of setting up VSLAs all over the country. Mohamed Bizimana, also known as Bizimana, is our assistant country director for programs in CARE Haiti. They have one of our largest portfolios of food security programs, establishing VSLAs all over the country. And Clement Masai, Clement, if you can open your video, is our monitoring, evaluation, and research lead in CARE Malawi. So welcome, friends. So let's start. My first question to you, Bizimana, can you describe the process that CARE Haiti undertook to rapidly assess the needs and priorities of women and girls in VSLAs at the outset of COVID-19? You're on mute, Bizimana.
Great, sorry. Thank you, Vidya. Thank you, everyone who's joining this discussion today. As Vidya mentioned, my name is Mohamed Bizimana. I'm currently working as Assistant Country Director in charge of program for CARE Haiti. Coming back to the first questions, as you all know, COVID took all of us by surprise. Nobody knew how to respond. And in Haiti, we were one of the countries that were affected very late. So it gave us chance to start looking at how other people are responding to it. As we were preparing, thinking through all the preventive measures, when the COVID broke, the crisis started, the government immediately released a string of restrictions. So these restrictions not only affected us as a project teams, but also affected our beneficiaries. One of the things we quickly realized, we had to put a halt on activities, on VSLA activities. We couldn't continue supporting them. Themselves also couldn't continue conducting their weekly meetings and activities. But in front of that reality, what we wanted to understand how this is affecting and will continue to affect their ability to save, their ability to pursue their activities. So we took a step back and agreed to do a survey, but conducting a survey itself was a risk because traditionally in Haiti, people will do survey in person. And for us, we didn't know how to do the survey in person the traditional way with all the restrictions. So we had to adapt quickly the way we do it and do a combination of in-person survey using our VSLA agent. These are community facilitators who sit in the community where we have VSLA, and some digital tools. So here we'll use ODK or Kobo for those who are familiar with data collection tools. And those one, now we had to set up a survey questionnaire through Kobo, train in very small group of people, community volunteers, who then administered the survey. So some of the questions we wanted to know is whether, what are the source of information VSLA members do have access to, what type of information they do use often, or they do trust, and obviously whether the restriction of movement is affecting their saving and loan activity. So it was quite interesting and quite insightful to hear, to get all this response back from the group, and to look at it from a gender perspective, look at how women, who are the majority of VSLA, respond in terms of source of information, and men, and how the restrictions imposed by the government are affecting their saving and loan activity. I'll stop there for now. Thank you.
Thanks, Bizimana. We'll get back to what you actually learned and how you applied that to programming in a little bit. But Clement, I would like to ask you the same question. I know in Malawi you took a slightly different approach, using a combination of rapid surveys, mobile surveys, and in-person. So can you talk a little bit about how you reached and heard from women, and how this combination of tools and approaches enabled Care Malawi to better respond to their needs? If you wouldn't mind turning on your camera as well.
Okay, thank you very much, Vija. I think Malawi took a number of ways of trying to assess the needs of the VSLAs in the rural communities. Among them, we actually conducted a rapid gender analysis, which actually informed us about a number of issues which are actually happening in the communities to do in relation to COVID. One of the methodologies which we also used, we actually tried to be calling community agents to learn about the situations in their communities, to appreciate how COVID was affecting their groups, but also to actually appreciate how people are adhering to preventive measures, particularly because during that particular period, we had a main lockdown in the country. So we actually used that information from different methodologies to actually develop specific messages which were actually responding to what we actually found out. Just also to mention, we are represented in different clusters. So in the clusters, we also use the secondary data which we are getting to appreciate the needs of the VSLAs. Thank you for the time being.
Great. That was very succinct. Thank you, Clement. Mariam, I'd like to turn it over to you now. So Care Nigeria took a similar approach as what Clement has just described, doing mobile surveys, in-person, and rapid gender analysis. Can you talk a little bit about how Care Nigeria has used that data, the information that you got from that process, and what changes you've made in your programming based on that information?
Yeah, hello everyone. For Care Nigeria, we also, as you rightly said, conduct the interactive voice response survey, as well as the rapid gender analysis. So from what we were able to get out of the survey in terms of how COVID affects our project participants, especially the women, is more of related to gender-based violence, as well as the need for us to keep in touch with this group in terms of when there is lockdown. So we try to adopt a mobile app to pass out information to these project participants, where we pass out project-specific information, gender-based violence awareness and information, as well as COVID response and adaptation information to the project participants. Also, we try to, at country level, see how we can alleviate some of the concern raised by the participants in terms of getting a lot of windows of opportunities for COVID response grants. We applied several grants where we were succeeded in some, and most of them we directed them through to the VSLA groups. We try to see how we streamline it towards what we were able to get out of the surveys. So we conducted some of the projects, which most of them are still ongoing, in terms of SRH activities, sexual and reproductive health activities, which is one of the concern from the participants. Also, we try to see how we have some kind of income generation activities for the groups, which economic aspect as well as the livelihood is most affected from the survey. That's the concern raised by most of the participants as their top priorities. So we try to see how we mitigate that. Issue of education is also among that, being school lockdown and the fear for the women to see early girl child marriage might suddenly erupt and lot of dropout activities. So we try to see how we liaise with the government official as well as some of the learning within the community to integrate a kind of adult learning activities within the VSLA group activities. Since most of the group adopt COVID guidelines and still be meeting with social distances as well as face masks. So we try to see meeting up those criteria during the meeting and also creating awareness among the group members. Also, one unique thing we try to identify is seeing how at country office also try to support the livelihood activities of the participants in engaging them as project volunteers in most of the COVID response project we have as project paid volunteers, and they serve as agents of awareness in terms of COVID response, sexual and reproductive health, gender-based violence, and also try to encourage people to be more independent and self-reliant, especially through this. Thank you.
That's wonderful. So effectively, you, in 8 short months, you found out what they needed, what women and girls needed around education, school dropouts, early child marriage, gender-based violence, and you adjusted programming by raising new money to address those very concerns. As a follow-up to that, can each of you talk about how your CO, your country office, responds to the needs of VSLA members and how you continue on an ongoing basis beyond COVID-19 to adjust programming as the crisis evolves, because we know this is going to be here for a while. So Bizimana, can we start with you? How is Care Haiti adjusting its programming now? And then how does Care Haiti plan to continue adjusting programming over the life of the pandemic?
Okay, excellent. I'm muting myself. Yeah, thank you, Vidya, for the follow-on question. As you had mentioned, our portfolio is made up by food security programming, which is the largest bit of our programming. And as part of that, that particular programs is in response of a crisis which was already there. So before COVID, there were already a food insecurity crisis, and on top of that one, we had another social-political crisis. So then you could understand the dynamic. These were kind of 3 layers of conflicts or crises piling one on top of the other. One of the things the survey helped us to understand, because as we entered this troubled period with COVID, one of our concerns was to continue keeping VSLA functioning, right? To continue that momentum we have started building with VSLA as a tool for responding quickly to household needs, but also as a tool to bounce back when the situation comes back to normal, right? So one of the things the data allowed us to understand was really to understand how women and men who made VSLA access risk communication materials and messaging, right? And this it was very critical that we saw probably the men will rely on the traditional communication channel like radio or messaging via WhatsApp, but women mostly will rely on one-to-one conversation. So when they are going back to their activities in VSLA, they will pass on messaging, right? And then we realize some of the messages may come whether through a spot on radio or TV, or a cartoon that was shared via WhatsApp, right? So that one helped us to understand, okay, we can continue providing, we can do a targeted risk communication to VSLA member using this village agent I mentioned earlier, we use for the survey. We can also have a dedicated channel on WhatsApp, really targeting members of VSLA and try to help them create a kind of WhatsApp group to continue relaying the message. So that was one way we used the data we collected to better improve and target our programming, our response programming. The second way we used was in relation now to, as I said, COVID came on top of other crises, right? So there was an issue as we were responding to COVID. We had either to expand our targeting, the people we're reaching, or look into the people we're already reaching who are the critically vulnerable and at risk of contracting or being a transmission mechanism for COVID. And here again, the data allowed us to understand how we can work with these village agents and specific members of the groups to really understand in their community who do they identify as the most vulnerable to COVID, to contracting or being affected by COVID. And then that one helped again improve the way we do targeting and involve VSLA members and VSLA community mobilizers, village agents in the targeting process. Something which traditionally will not do. Our project team will go in with a long list of criteria and see who fits where, right? And validate that one with local authority. The last one we did also learn from the data. We learned that groups had already started some adaptation, right? In terms of reorganizing their meetings. Instead of coming into a meeting of 30 people per week, every Sunday or every Tuesday, they will organize small groups of 15 initially. And then when the government dropped the number of people who can gather at the same time in the same place to 10, themselves also adjusted it to 10. So people will come in smaller groups of 10, come and fulfill their saving and loan activity for that particular week and leave. As they leave, the committee will remain and receive another group. So there was that one, we learned from that. But we were also curious to know how do they respect those preventive measures. So they had already set, as you all know, Haiti is prone to crises. So cholera is one of the crises that is prevalent in Haiti. So they all have the basics for the hand washing. They know it from their head. Quickly, they started establishing hand washing stations and creating those social distancing measures as people rotate to come for their weekly activities. So that was also, it's something we learned from the data and immediately instilled it into the programming. So going forward, as we move forward, again, due to the nature of Haiti, with its geographic position, it's prone to crises. So we are now still learning how can we quickly be able to rely or build from this network of village agent community volunteers we create to really quickly keep monitoring things that might create shocks or stresses that might disrupt activity of VSLA, and quickly have a system to learn how the groups itself is pivoting to continue their activities. Because for them, VSLA remain at the heart of their well-being, if you like, because that is the main source where they'll get little money to cover their daily needs, their subsistence needs. So I'll stop there, to give space to others also to share their experience.
Yeah, brilliant. Thank you, Mohammed. I mean, if there's one thing I know about VSLA members, they are incredibly adaptable, and it's more us responding to what they need and how they're, responding to each other. So that's perfect. Mariam, same question to you. In Nigeria, you've talked about how you've already adapted your programming and your fundraising to meet the needs of women. How will you continue to assess their needs and respond to those needs over the next, say, few years?
As I earlier said, we keep on the information, reaching out to these groups. We know we have a large number of groups that meeting them one-on-one can be too difficult for an officer or a community-based trainer. So we still maintain the mobile app communication between us and the participants, which is we can reach a wider range of numbers within certain period. And also we try to see how we link these groups with the microfinance bank for them to have a stronger income generation activities, which is a kind of group activities. All groups have been trained in different kind of income generating activities specific to their community. They conduct the market assessment. And also these activities is more of monitored activities for now, for us to see how the group income generation activities or group business can stand on its own. Some groups have even begun financing this, their proposed idea with their social funds for them to start seeing how the activities would prosper. And also we try to see how we link these groups with other granting organizations as well as the government. We tried discussing this with some state government where we implement how they can integrate the VSLA activities into their women economic empowerment activities, which is a welcome idea by the government, and we are trying to see how we make this possible. And also we try to see how we make this a kind of national cluster VSLA activities. We began at the local government level, moving to the state, and then the state we have a kind of umbrella for them to be speaking with one voice. So that's a plan that we are planning towards the 2023 election. We need to see these VSLA women coming out in active with a lot of voices. In some local government, they've begun engaging their local government authorities with some kind of demands. We have about five clusters that met the local government in needs of women vocational center in their local government. So this is a kind of welcome development activities. And we are trying to see, we move out these women in the psychology of just saving and getting loan out of it. What we need to do as women, what can our voice do, and how far can we go? So basically, this is what we are planning for now. And it's going to be way beyond COVID, as this is a part of our awareness agent within the communities. in most cases, we were able to station wash hand station in a lot of places in the community with some of the grants we have. There is a community that we have about 145 washing hand stations, and these women were tasked to be responsible for those. They selected the location, and also they were in charge to see how we have a kind of standard running water throughout within the washing hand buckets. And the groups were trained on local formation of hand wash and hand sanitizer, which is part of their kind of corporate social responsibility to be providing when the one we provide went out of stock. And it's kind of a deal between us, and they welcomely agreed with that. Which even the local governments were happy to see the development, and I believe they will also support in that. So one key thing we are trying to see we do as CARE is to just set the ball rolling. We know these women have a kind of 101 demands to make, but they don't know their capacity, they don't know their capability, they don't know they can do it and make that changes. So we are trying to see how we identify men that will back them up, support them, and give them all the necessary strength they need in making those changes. So basically, this is what we have begun and we plan to do in the future. And as COVID still evolve, for now, we are lucky there is no restriction of movement and meeting, and we don't know what might happen next. We don't hope so, but we need to be more ready of the worst might even hit us next. So we try to make these groups more resilient to do this. As being women, we don't need to be the weaker sex at the set, so we can do it and we can stand by our own. So this is one of the key things that we have begun, and within those communities we are in, the men and even the Emirate Council once invited us to see it. It's a welcome development idea, and women have begun to make changes within the communities, within the households, participating in financial discussion, financial decision within the households, and also they began to do community decision making. So this is some of part of what we've done. I think the question and answer session will be able to get more of the good work we've been doing here.
We'll save a little time for Q&A. Thank you, Miriam. But you know what I hear both you and Bizimana saying is that in Nigeria, like in Haiti, there's complex and multi-layered crisis, cyclical crisis. So it's not just about responding to COVID, but looking at how to be prepared for any crisis. And it seems like you plan to leverage the networks you formed, the platforms you're using, mobile or otherwise, for responding in the future, which I think is fantastic. So Clement, same question to you. Malawi, I know, is kicking off some very large food security programs. So how has this crisis informed what you'll be doing in those programs going forward? Clement, you still there? I think we might have lost Clement. Well, if Clement comes back, we will continue with that conversation. But how about, since we have only about 10 minutes left in this session, we turn it over to our attendees and see if they have any questions for our participants, for our panelists. You can either unmute or type into the chat. I think it's a small group, so you can always unmute and ask questions of our experts.
Sorry, I got disconnected.
Oh, there you are. Great, great, you're back. Okay, could you talk about the last question I asked, which is how are you going to continue adapting your programs now that you've established some protocols for reaching VSLAs, how you communicate with them and how you respond to their needs? How will you continue adapting programming in the future?
Yeah, thanks so much. I think we are likely to continue adapting our programming because some of the things we have learned, we would need to actually continue. For example, because of the restrictions, we have learned to actually use the interactive voice recording as a means of communicating to communities, as a means of educating communities, as a means of collecting data. I think this is something which we cannot stop, even if the cases of COVID have actually dropped. The other thing is we have actually learned that COVID has affected the VSLAs in terms of their livelihood, in terms of their saving capacity, and in terms of their ability to repay the loan. So we are actually thinking that we need to continue adapting by considering recovery interventions in whatever we're doing. Apart from that, we have also learned that almost 35% of the VSLAs have had experiences of gender-based violence in the during the period of COVID. It means we need to start integrating greater gender-based violence modules in the VSLA methodology. We also need to think about strengthening, linking the VSLAs with microfinance, formal financial service providers, so that they can actually meet their unmet financial needs, which have actually increased because of COVID. So I think those are some of the things which we'll actually continue to do in the context of COVID, but based on the lessons which I've also learned. Thank you.
Thanks, Clement. We have one question from our audience member, and any of you can unmute and answer this. If you could change anything about your response so far, what would it be?
Yeah, I think let me just take this. For me, for Nigeria, I don't think there is something that we need to change so far, but what I will add to this is, what if I have the chance to do more, is more of the income generation activities to reach out to all the groups we have. For now, we just sampled 100 out of it, which is just reaching 3,000 women out of the 42,500 we have. So for me, it's not changing anything, but adding more to what we've done, because seeing how COVID affects the economic aspect more, and there are a lot of cries out there that economic, food, livelihood is the most affected aspect of life. So I think it's for us to do more in that aspect. Thank you.
I can just add on my part. I think we have actually done a lot of distribution of PPEs, personal protective equipment. We have actually invested a lot in messaging about communication. But I think moving forward, I would actually wish to also prioritize providing resources which will directly be used by the households, because COVID has actually affected their livelihood. Thank you.
Clement, do you mean cash resources or food distribution?
Yes, of course. I think considering doing cash injection, so you could actually provide a cash to the VSLA group to increase their loan fund, so that it is actually keeps them going. Where necessary, for certain areas, you are providing actually cash to meet certain basic needs would be more helpful than to invest quite a lot in PPEs.
Yeah, fair enough.
Thank you.
We have one more question from.
Just to add a little bit, especially for a context like ours, where we have as I mentioned earlier, these layers of conflict, of crises, sorry. What I'll do differently, I'll change the way I do my cash and voucher assistance programming on the one end, and really try to integrate some restrictions to help people save, even if it's a cent or 10%, but continue that culture of saving, right? Because when a crisis hits, often it will decapitalize people, and that one will sweep away all the momentum built in terms of culture of saving and culture of working with financial service provider. So that one I'll change. I'll try to instill some restrictions. The second one I'll change is the way of being reluctant to trust local stakeholders because we are too much worried about quality and about reach. We tend to have our own teams on the ground. So those two things I'll try to change them. Thank you.
Great, thank you. And then one other question from Cheryl. To the extent that your agents, village agents, have adapted to this new technologies to respond to the crisis, what has helped this adoption process?
For me, the reach out one, we were able to reach out to larger group of individuals as the group. Like we were able to reach out to all the locations where we implement with their phone numbers. And also we reach out with information project specific. We reach out with COVID awareness, information and adaptation and responses. We also reach out with GBB responses and reporting mechanism. And also we were able to conduct a survey to identify the needs of the participant and also how COVID affected them, which inform our decision in making other proposals and projects. So I think this technology helps us reaching out more and quick and fast, very cost effective to me.
Clement or Bizimana, same question?
Yeah,
yes, I can just.
Okay, Clement, go ahead. Yeah.
I can just add that I think one of the reasons why the adoption process has actually been increased because we are able to identify the actual needs of the communities and repackage our messages based on the needs. But we also got feedback in terms of what we should have actually improved in how we are actually implementing the entire project. For example, in Malawi, the interactive voice recording messages, we used to start sending them on a Sunday. We got a feedback that on Sundays, most of the people are in church. So that's why we see a lot of people missing the messages. So we had to change. So I think that those are some of the reasons why we've had this. Thank you.
Yeah, just quickly, VSLAs and field village agent, they are really at the center of adoption of new technologies or new practices, especially as they are a group of people who have already a solid relationship, and they meet and they engage in collective action. Probably not to take the highest end of technology with all the digital solutions. That's if we take a simple technology like TP-Tap, just to have people have access to clean water for their hand washing, right? This village association groups and village agent, they are really the kind of at the forefront of introducing that technology in their village, accompanying the adoption and the scale up. And now we see wherever we introduce TP-Tap via a VSLA, when you go back a few months later, it's almost everywhere because of their connections in their communities and their reach in their communities.
Yeah. This is actually a really good segue to the last thing I want to say on the subject, which is that largely based on the work done by my colleagues here, we at a global level as CARE have developed this initiative called Women Respond. And it's basically to find out three things. One, how are women coping with the pandemic? What are their needs? And thirdly, how can they be engaged in the response? And as Bizimana has just said, members have a lot of influence, not just within their communities, but we see that the model replicates rapidly without CARE, right? So for every VSLA we form, one forms on its own. This is a powerful network for us to tap into to understand the ongoing needs of women. So we've started on an initiative across 6 countries in East and West Africa to rapidly survey VSLA members using a variety of methodologies, mobile, on the ground, in person, qualitative and quantitative surveys. We'll be pushing out communication on what we find along the way. So anybody who's interested that's here now can reach out to me and we can share those communications. And then we're also continuing our gender analysis in 65 countries, right? That sort of informs our response very rapidly and helps us kind of put a toe into what we're going to do going forward. So this is a process that CARE will continue doing, continue evaluating how communities and women are responding and what they need. So stay tuned if you want to know more about how VSLAs respond to COVID-19. And thank you for allowing us to share our experiences with you. And thank you most of all to my panelists for joining and sharing their amazing insights.
Thank you. Thank you all.
Yeah, thank you.
Thank you.
But Bidya, we still have one question. Maybe you can just respond to that related to issues of the technology. So the technology is just a mobile app and you just receive a phone call. You don't need to use anything and any mobile can serve, and that is just for you to receive the phone call.
Mm-hmm. Yeah, Lydia, one of the things is that we have struggled with who has access to mobile technology. Often that is not the woman in the household. But as Bizimana has said, if we have the mobile number of the village agent who can get to women VSLAs, and that's the nearest possible node of communication, that's okay. We will do whatever to adapt to the capacities of women in VSLAs. So yeah, access is an issue, but we have figured out how to get that. Where women have access, we're more than happy to communicate with them on their mobile, but if they don't, we find other ways. Was there another question? No, I think that's it. I think we're right on time. So thank you everyone for joining us, and feel free to reach out to us at any time for further questions. Have a good day.
Yeah, thank you. Thank
Thanks,
you for
Mariam.
your
Thanks,
audience.
Bizimana.
Bye.
Thank you.
Yeah.
Bye, Clement.
Bye.